I am Barry Siegel, founder of the Siegel Family Foundation and Focus for Health. My organizations help people in Africa and the U.S. gain the things they need to live a better life. We've partnered with Middle Collegiate Church and the Middle Project to bring you this informative webinar on racism as a public health crisis. Reverend Jackie Lewis is a force in the quest to form a more perfect union through her work with these organizations. Focus for Health is proud to support all the groups here today, including Be More America, Social Change, and the Black Women's Blueprint. I want to thank Linda Villarosa, a journalist who has identified the health disparities of minority communities, for taking time to join the discussion today. We believe that together we can achieve a better America, a more equal America. The best people to lead this change who are the people who are in the fight from the communities most affected. With that, I would like to introduce Anu Gupta, the Executive Director from Be More America. The organization is working on breaking biases so we can live in a better world. Anu is an innovative pioneer in this initiative. Thank you, Anu.
Thank you all. Thank you so much for that introduction, Barry. Let's jump right in. So, Linda, I am so thrilled to have this conversation with you. One thing I was telling you when we were preparing for this is that the seminal piece that you wrote for the New York Times Magazine a few weeks ago is that racism is a public health crisis across the board. So many public health experts, physicians, psychologists have called racism a pandemic in our nation. I'd love for you to comment and respond to this question that I always receive is, how is police violence in the and with George Floyd, Breonna Taylor, and so many other innocent people a public health issue? Can you explain?
First, thank you for having me. Welcome everyone to this discussion. I'm really excited to talk to Anu about this and later the panel. I get this question a lot too about how, first, how is racism a public health issue? One, and then drilling down, how is violence and specifically police violence a public health issue? And it has to do, well, the first way I want to think about it is to think of George Floyd's dying words where I can't breathe, because he actually was suffocated by police, state-sanctioned murder. The other way we think about I can't breathe is the environments that Black people are more likely, and other people of color are more likely to live in. So our environments where we live, eat, work, play, pray, have been subject to historic redlining, have been subject to disinvestment, have been left behind. So they end up being less healthy. That means we have less access to healthcare. We have worse food, less access to affordable, healthy food. We have less access to green space. We also have less access to safety. So that means in our communities, we, it's not safe, and our are often over policed. So now we live in an unhealthy environment. And the worst aspect and most obvious aspect of an unhealthy environment is the environment itself. So that means unhealthy air. So again, if you are subject to unhealthy air and all of these other unhealthy aspects of communities of color, and just as a side note, even when Black people have have higher incomes in education, still live in these kinds of communities, more likely to live in these kinds of communities compared to white people with only a high school education. So here we are in these communities where we can't breathe. And so I just started thinking, and COVID is a disease of the lungs, and you can't breathe. So that is the simplest way. If you think of just the right to breathe, it is essential. And if we can't do that because of these environmental factors, including racism and including state-sanctioned racism, it's just unfair.
Linda, I'm so glad to meet you this way and grateful for the work you do in the world. Thank you. Todd, it's nice to meet you. Let me ask you this question. How are you responding to the crises of racism, COVID, and police violence in our society? And particularly, could you share a story of the challenges you're facing as a leader at this time.
Absolutely. Thank you all for giving me the opportunity to join you all today in this really pivotal conversation. I think we're in such a unique time in our history. Just imagine, no matter where in the world you are, not too far from your doorstep, there's someone holding a sign simply saying, "Stop killing us. Stop killing us." What's more basic than that? I challenge those who have the opportunity to participate in this conversation to look in the mirror and ask others to do the same, and ask yourself, is there more you can do to make sure no one in our society has to cry out simply for the opportunity to live? And as we work on social change, we do 3 concrete things to try to fight for liberation for people in all communities, but particularly in the Black community, as you mentioned, which deals with the most significant problems. 1, we use storytelling as a mechanism to make sure more people understand the struggles of people all over the world, principally through our International Social Change Film Festival. But we then also leverage media networks as well to make sure the stories and the pain, the suffering of people all over the world is being seen so other people can feel it. And then once you feel something of that significance, then at that point, you're compelled, your humanity requires that you do something about it. And doing something about it takes place in 2 different ways through social change. 1, direct action. Right now, as it relates to COVID, and long before COVID, the epidemic of racism and poverty have been scouring or really devastating for generations. So we make sure we provide food to those who are hungry, providing over 100,000 pounds of food in the last few months as a result of all the different issues going on. But also that means responding to the needs of communities. When folks say they're hungry, we have to do what we can to respond to that. And the third aspect of the work we do is, why are people hungry in the first place? And it gets really to the systemic issues that are being brought to bear today. What is it about the system that makes the people who are hungry, the people who are jobless, the people who are homeless, the people who are in prison, always look the same? So we work to change the laws responsible for our oppression by making sure that we're giving the opportunities that we merit, or giving opportunities to live, but also an opportunity to get the basic necessities like quality education, a good job, and opportunity to own businesses and housing. And in the context of that, what we're seeing in terms of storytelling, people are in pain. People are hurt. People are terrified. People are terrified not just by wondering how they're going to keep food on the table, but also they're terrified about the notion of being exposed to COVID. And they're terrified about the idea of just the concern of wondering if they leave their house, whether it's to do anything from jogging to just go pick up something for a loved one, if that will be the last day that they come home because of what we're dealing with now with state-sponsored violence. So there's so much going on, but this is the perfect forum to have this discussion. And I really appreciate you all giving me the opportunity to share a little bit today.
Todd, thank you so much. Thank you for the work you're doing and for sharing that. Farah and Savannah, thank you. We're so glad you're here with us today. I want to ask you, did being female add anything extra to the COVID lockdown, do you think, that people of color feel? And what are the health consequences, especially of racism to women? Love if you respond to that. And again, welcome.
Absolutely. Thank you. And I hope you all can hear me. Thank you so much for having us here. It's really an honor to be part of this panel. Absolutely. We have been seeing the impact of COVID on Black women in particular. And for us, when we say Black women, as survivors ourselves who lead organizations and lead movements, we're seeing it in our own lives. As we know, during epidemics, the very measures taken to protect populations and keep health systems afloat leave women and children especially vulnerable to violence, to all forms of violence, and especially Black women and children. I mean, we can talk about the UN Population Fund's report, which suggests that domestic violence, sexual abuse of children has risen 20% all across the world. And in New York City, where we're located at the epicenter, it's risen by 3 times during the COVID epidemic. So viral pandemics like COVID, during those pandemics, we're often left in an ongoing state of risk and worry, triggering overexposure, stress hormone release in our bodies, elevations in high blood pressure, in our heart rates, in heart palpitations, associated with aggression, fight, flight, freeze, placate, or trauma responses for Black women, which we were already living with, which we were already experiencing, as a result of not only multi-generational trauma, but the systemic violence that we experience on a daily basis and that our population experiences on a daily basis. Other health issues, of course, include any health issue associated with trauma and a trauma response and complex trauma responses and complex PTSD, which impacts the very immune system, which impacts our mental health in a way where we can talk about depression, we can talk about the heightened levels of anxiety. These manifest in our body in terms of insomnia, in terms of digestive issues, and many more forms for Black women. One of the things that Savannah and I and us at Black Women's Blueprint, we have always said is because of the isolation that women and children experience and the heightened level of abuse, that women's groups, anti-violence groups, child protection groups, all protective services for women and children should have been and should be in the future classified as essential during any pandemic, during any disaster. Domestic violence hotlines, safe spaces, sexual and reproductive health services, all of these should have been primary and essential services in order to help deal and mitigate the health consequences that not only resulted as the fear of catching the virus, of living through that virus, but also the increased violence and vulnerability for Black women and children.
Conversation. So let's keep it going. Let's heal the world. No justice, no peace, or no KNOW justice, and no peace. Bless you and have a fantastic day. Thank you all again. Bye.